Hello, everyone. I'm Ann Borda from the Center for Digital Transformation of Health at the University of Melbourne. And I'm pleased to welcome you to our spring seminar series at the Center for Digital Transformation of Health at the University of Melbourne, led by Wendy Chapman. I would like to follow with acknowledgement of country. As we gather for this meeting, we respectfully acknowledge the traditional custodians of the lands upon which our campuses are located, the Wurundjeri and Bunurong peoples, Yorta Yorta Nation, and the Jagalung people. We pay our respects to their elders past and present of the Kulin Nation and extend that respect to other Indigenous Australians present. Thank you. And before I introduce Claire, just a housekeeping, please keep your sound on mute in respect to the speaker and presentation coming. Please feel free to use the chat, post questions or comments, and we will have a live Q&A after Claire's presentation. So Claire, welcome here. You're coming live from the UK. We're very privileged to have you here. And it's midnight over there, so you know, we really respect the time difference and your wonderful contribution to our seminar series coming in at this time. Claire is from the well, she's a co-director of the Lab for Living and comes to us also as from Sheffield, Hallam, professor of creative design. And Claire is an occupational therapist by training, leads an interdisciplinary research group. She is focusing her research on the role of design in promoting quality of life and well-being, particularly in the context of people experiencing major life transitions. So I believe our presentation today is very much in that line. It's a very wonderful title as well, so we're really looking forward to hear your presentation, Claire. And without further ado, welcome, and please we'll give a round of virtual applause to Claire. Thank you, Claire.
Oh, thank you so much for that introduction, and thank you very much for inviting me to be here this evening stroke day in terms of Australia. So I'm just going to share my, I'll just share my screen. Perfect, hopefully you'll be able to see this. And lovely, fantastic. Is that clear for everybody? Wonderful. Okay, so I've entitled the presentation Beyond 100, Designing the Digital to Reimagine the 100-Year Life. And what I want to do is to really use this next 30 to 40 minutes just to kind of give a broad overview really of the work that we've been doing in the research lab where I'm based in the United Kingdom. So I'm going to begin the presentation with an introduction to Lab for Living and a little bit more about the context of where I work and particularly about the methods that we use. Then I'm going to talk through some of the live projects that we have, including a project that has been looking at the 100-year life and the future home. And maybe hopefully a few reflections on that project in the context of the events that have unfolded over the last 2 years, particularly in relation to the pandemic, and maybe what we learnt in that context around the methodologies that we were using, and maybe thinking about some of the broader contributions that technologies played in terms of advancing the work in service design. So I hope there's something for everybody, and I hope that what it will lead to is some rich discussion at the end, and I think that's the part that I'm really interested and excited in. So without further ado, so a little bit about who we are and the research methods that we use. As Anne said, I'm based in Sheffield in the United Kingdom. And this is an image of our university. And we were actually founded, our School of Design Education, in 1843. So I think that's probably quite, so we've been quite established, and really the art school came into being in the context of everything else that was happening technologically at that time with the Industrial Revolution, and recognizing that there's a real need for design to fulfill the function in a very changing environment that was occurring historically. And I think that there's a real resonance of that in terms of Sheffield as a city of makers and making, and also the context around a responsive design, particularly around thinking about technology and health. I'm co-director of Lab for Living, and we're an interdisciplinary research group based in the university that brings together design, creative practice, and health. And our whole reason for being is to design with people to create products, services, or environments with a focus on design research that promote quality of life throughout the life course. And we've been in existence now for about the last 14 years. We're a member of the European Network of Living Labs, and also we hold a biannual conference called Design for Health, and we have our own journal, which is published through Taylor and Francis. At the centre of all that we do is designing with people, and we have a community hub in the centre of Sheffield, and the beauty of that is that it means that we're really focused in the community, because we know that when we undertake research with people, that actually the products, services and interventions that we develop are just much better, because we're really drawing on the experience and the expertise of the people that are experiencing and living that experience. So it's a massively important part of our work, and has been right from the very beginning of when we were established. Central to that is using creative practice as method, and I'll give a few examples of the way that we do that. And I talk about this, I think, particularly around our technology research, because it's just so integral to what we do. So the way that we involve people, and it's a very authentic involvement. So people in the community, people who use services, who are end users of products, are involved in the writing of our research proposals, in the formation of the methodology, and are often trained as co-researchers, and are often paid through the university and through our research funding. So, for example, a project we did looking at the future bathroom, we employed older people to do that work in partnership with us, and we train them in research methods. And again, I think this is important. I think it'll become clearer as I continue to present. The power of that is that there was far more authentic engagement, and really understanding about how we might truly design with end users in mind. Other methods that we use a lot of, this is called the field lab, and the field lab is, as you can see, it's a bit like a giant maze. So we also believe that the way that we truly work with people is by enabling individuals to actually experience and engage with physical objects and artifacts I can tell you the ergonomics of a good design of a chair, but I don't know what I want from it until I sit in it. So we create these spaces and scenarios where we can truly engage with people, and they can test things, try things. The future bathroom project was lovely, as you can see in this diagram. We had an electronic graffiti wall in there, which is often synonymous in the United Kingdom with public toilets, and people were actually able to kind of give feedback through that. But it's an amazing installation, and ensures that we can really we're agile and mobile. And can work with people where they're at. Often we'll take our research tools to people's homes, and so the home becomes the environment where the research environment where we begin to engage and learn things. And this is an example from our work called Exhibition in a Box, based on Duchamp's Museum in a Box. And again, it's a set of really simple research distilled tools that we believe that you can have a conversation about any facet through these 9 objects. And that's been a really big element of our research around technology. Again, I'll come back to that in a moment. Through these methods, through working with people, we create, as I say, a kind of a range of research-informed products that impact on quality of life. And these are just some examples of the things that are out there in the real world. You know, a big focus of what we do is on applied research, and where our research manifests itself in things, those things do go to market and do live in the real world. And I think that's also very important to say. So these are just some examples of the things that we do. And a big focus of our work, our research, is around health technology. And again, this is just massively varied. The breadth of that, it's very wide. And that goes from kind of very hospital-based technologies. So, for example, this is a nurse call system. It was the first fully dippable and infection controllable nurse call system to be developed in the United Kingdom. I think that the original design spanned 14 years ago, and we're in the second iteration now. But equally, we work and we engage with different types of materials. And again, so this is a really nice example of a product for people living with motor neuron disease. Again, research informed, but the technology is in the material itself. And again, to support reduce head drop for people living with motor neuron disease. A lot of the focus that we have is around prevention, is around and health promotion. So working with people, so not just in a very acute hospital type space setting, but certainly in the home, and really thinking about what those products might be and how they might sit within the home environment. Sometimes the technology that we use and our focus on technology isn't just around the actual outcome, but around the actual methods that we use in terms of measuring and testing. And again, this is a good example of that. This is a product, a piece of research that we undertook looking at non-invasive ventilation for children. So a challenge that children have is around creating bespoke masks. We've seen that also in COVID-19. Because children's bone structure isn't quite as formed. What it does mean is that where masks are ill-fitting, the children either don't receive the right amount of oxygen, or if the mask is tied too tightly, it causes malformation. But the technology here is the building of the rig to measure the airflow, because it would be very difficult for us to do that on a live child in early product development. So a lot of that research has been around building the rigs and where the technology sits there. And then the other facet of the work that we continue to do is around the role of open design, and really thinking about how we involve people living with very long-term conditions in creating networks where, with the advent of 3D printing technologies, people can actually print their own products or assistive devices to support them in the way that they are engaging. So our work is really broad, and I think probably the kind of the strength of that is that we cover the kind of whole range, as I say, from hospital right through to thinking about technologies that might be embedded in paper or in ink, as this tactile map project research, and the technology there was really in the bespokeness of those maps, and what the that again, the bespokeness and how people living in the community could actually create this really interesting language that both catered for people who were both visually impaired but also not visually impaired. So it was creating a semantic language, and I think the breadth of that research and technology in health is what really excites us. We follow this kind of process, as you will, and I'm looking forward to, I say, hearing about what you're doing in your research and how we compare. But I think for me, there's something about those open design processes which mean that we can ask questions at the very beginning, and again, we use design and design methodologies to pose questions as well as to answer them. And this is just one example where Engaging Aging, a transnational research project, where we listened to the experience of people, and then what we turned the data into objects. So Paul Chamberlain led this work, and again, that notion of using objects as talking points to generate more data, and exhibition as a method to generate more data. And more latterly, Paul's work has really focused on something called hospitable, which is really the domestication of healthcare, and that notion of, as technology has evolved, we're seeing, and the home is becoming a place more where we're seeing health technology sitting. It raises really interesting questions in the context of, well, what does the home then become? And as I describe the next piece of work, the kind of focus of what I want to talk about today, you can really see that, particularly during COVID, and what the home is and what the home means. So that's kind of quite a nice kind of caveat to move on to. So that's the kind of context of where we come from. So we have 14 years of experience of working very much around using research and designing research with people to create products, services and interventions to promote quality of life. And as I say, a lot of that does focus on technology and also more latterly on digital technologies. So it was really interesting. 3 years ago, we were awarded a grant to look at the topic of the 100-year life. So I'm going to pause for a second now. Just this is probably not done. I don't know if this is done, but I'm going to ask you all now, please, just to pause for a second. And I'm going to ask you, what is your biological age? So I'd like you to think about that. And then I'm going to ask you to think about, okay, so if that's your biological age, how old do you actually feel? Okay, how old do you feel? And would you live your life any differently if you knew you're going to live to be 100? So I'm going to stop my screen share and I'm going to ask you that question, because it's a really important question before we go on. So what I'm going to do is, in the chat, what I'd like you to do is I'd like you to wave at me. Yeah, thank you, Alison. Fantastic. I'd like you to wave at me. If your age is, if the difference between your biological age and your how old you feel is more than 5 years, I'd like you to wave at me. So I don't know how you're going to do that. Just write your name in there. Yeah, brilliant. Oh yeah, just wave. This is better. If it's fantastic. If it's well, 10 years, do you want to give you away? And it can be either way. You might be 40 but feeling 15. I don't know. Okay, brilliant, lovely. Yeah, I'd love some direct audience questions. Okay, if you were going to live your life differently, if you knew you were going to live to be 100, how would you live your life differently? And I would really like, if possible, to open it up, because I think this is really important before I move on and I tell you about the research that we've been doing. So how would you live your life differently? So please feel free to jump in. And it's nice to see people, because it's a bit lonely when you're talking on Zoom. Yeah, this is much nicer. Yay. Hi, Leon. Fantastic. Great. I can recognise some people here. Sonia, you have to answer. I know Sonia well. Brilliant. Yeah, learn languages. Absolutely. Learn new things, playing bridge, different life goals. Lovely. Keep it coming. Yeah, keep it coming. Yeah, what other things? Would anybody travel more? Yeah, absolutely. Hard and risky things, taking more risks. Yeah, lovely. Retirement concept. We need to ban all of that completely. Yeah, definitely. Yeah, put off. Yeah, lovely. Yes. Oh, yeah, definitely. Definitely. Love it. Well, I can tell you about this this research. This the grant that we had. And I hope that this is interesting. But the grant that we were given looked at just that thing. It looked at exactly that thing. Okay, what the grant did is there was a piece of work that was really undertaken by Grattan and Scott. And it was really kind of a financial model. And what they argued is, look, at the moment, we tend to think of a 3-stage life. So we have like birth to 15, 16, and then 16 in the UK, it might be different in Australia, but we tend to work until about 65, although that's increasing now for our retirement age. And then during that middle period, when you're most busy probably with children and with all the other life things that happen with caring for parents and juggling all of that, that's a time when you're trying to bank enough money to then actually have enough to be able to afford to retire on. And that was seemed to be like the traditional 3-stage life model. Whereas in the 100-year life, you saw something that was much more of a multi-stage life. So this idea that, yes, there would be birth and education and work, but then there'd be this education and retraining, maybe a different career, a career break. And the way that Grattan and Scott framed that was that they were really thinking very much in the context of, that you would build up either tangible assets or intangible ones. So for example, an intangible asset might be when you were 18, you might decide you want to go traveling for a couple of years, and you'd build up that life experience, might build up lots and lots of contacts that would then sustain you for the next element. And of course, in many ways, it's quite idealized, but at that time, it was estimated that that the number of people living to be 100 were significantly increasing. So it was a really, really interesting configuration. And the United Kingdom government started to talk about this and see this as something in policy. For us, we were really interested because we asked the question then, is that, as I showed you up to now, a lot of the technologies that we were developing in terms of thinking about aging and lots of the products, did tend to stick to the kind of the 3-stage life model. But if you were really thinking then about technologies more generally and how they might be applied in these other spaces, it opened up a really interesting space and place. And I guess that question is then, you know, what might that reconfiguration mean for the products, technology and services that we might kind of think about in the future? You know, how might we start designing for ourselves now in a way that does look at travel and education and the spaces where we might want to play and inhabit. So we were awarded actually an £8 million grant to look at this, and the work that we began to do and that we started to do straight away continued to build on a lot of the of what we already had. So just to say that, I'm going to stop my screen again because it's just really nice. So yeah, get fitter. So I think this is really important. So I think there's something that we learned really quickly when we started to kind of rethink and look at this, which was really about those notions of who are we designing for and how are we really thinking about what that means. And I think that we realized that although we've always felt incredibly open in our lab, the minute that we really started to think about aging, we still had some of those really kind of stuck stereotypes that we needed to shift quite significantly. So kind of the next bit of where we moved to was really kind of opening up that discourse and kind of really challenging maybe how we were thinking about, rather than dividing into thinking about let's design for aging, for older people, let's just design for the life course. And I think that for us was really important. And again, it would be great to hear what you're already doing and saying, oh yeah, Claire, we know all that. We've been doing that for years and years and years. Well, I think we thought we had, but I think that there was a real kind of shift in what that meant. And really, you know, part of that was, you know, there were some really exciting projects that we were already involved in that we continued to build on through the grant that we had. And one of them was a project called A Story, which was a project which is about novel empowering solutions for older people to really retain everyday life activities and recognizing the importance of meaning and how we could use really simple technologies to continue to help people to connect with the things that they enjoy doing. And we knew that there was some, you know, continuing fantastic research that had started by Gina Jackson and Florence Clark, Living in a Meaningful Existence in Old Age, which is really about the importance of purpose and meaning, and those being the kind of driving factors that enable people to live well. And The Story was a system that was built that enabled people to understand what was really in their community and how to connect with other people to enable to build those communities and to enable that to happen. And that was a fantastic piece of work led by some colleagues, and we were part of that with some colleagues in Milan. Through the funding that we had, we could continue to work on that, and there were some really lovely results that came from that, although there are some funny stories that I will tell you in a moment. The other bits that we could continue to build on that were really exciting looked at the other extreme of life, which was around end of life, and really thinking about that differently. And that work was again colleagues up at Northumbria with the amazing Jane Wallace, and really kind of challenging conceptualizations around end of life, and building on the work of Dennis Class to really think about technologies of enabling us to kind of keep connected and to not disengage with people who we might have loved and lost, but to kind of continue an ongoingness of that, and an ongoing relationship of not through a continuing bond, and embedding that learning and that experience. And these are two examples. The trails was a way that people could connect to places of meaning that had resonances with family, and which was really about legacy and generation. And then the Refined was a way of reconfiguring how we saw or connected with or thought about people who who we'd lost, but also that had meaning. So these were really, really fantastic projects. But as I say, fundamentally, you know, the biggest finding that we had through the work that we were doing was this kind of this like complete challenging, the need to reconceptualize who we're designing for and how we're designing with people. So this was going really, really well, and you know, fantastic, absolute dream of a research grant, and then of course we kind of hit you know, a slight challenge. We divided the work up into a series of different different facets. So we'd got some really interesting work which was around reconceptualizing aging, which was really looking at redesigning lifestyle, thinking about the digital. We had a whole body of work looking at end of life, as I mentioned, with the project, including Jane Wallace. We had some really interesting work that was happening around dementia and really thinking about ways to enable people to keep living well with dementia, but through connecting with family and technology, which was fantastic. We're doing a lot of work about the future home, particularly around the future bathroom and new domestic landscapes of care and the future. And then we had a strand which was looking at the future care home. So we were kind of covering the whole thing. But then, and we've produced some great things through that work. So I should say that. And, you know, these are just some examples of the work that came from that. And some of them were very technology based and some of them weren't. You know, some of them you know, were about challenging conceptualizations of who people are and how we think. But then COVID-19 hit, and what we saw in the work that we were doing was that technology in one place was increasing the loneliness and feelings of loss that people had, and then at another level, technology had the potential to address loneliness. And I think what we tried to do was we tried to almost turn that around. It would have been really easy at that point to have just kind of put things on hold. You know, lots and lots of our access to working with people had kind of frozen. But actually we thought, no, wait a second, let's really think about this more carefully. You know, how can we continue to engage in the methodologies that we use with people, but using the technology to do that? And can technology maybe help to move things on in a way that maybe the projects wouldn't have moved as far with in order to do that? So I'm going to give just two examples of this. And then, as I say, what I really hope is that we can just have a really good discussion, yeah, if that's okay. So just two examples. So the first one I'm just going to go back to, which is about the dementia work that we were doing. So the research on this project to take us on was really to kind of relook and revisit about what dementia was and when people were diagnosed with dementia and how we support people with dementia who have a diagnosis of dementia, and really about working with people at a really early point in that dementia journey. And we got to the point where we were ready. We developed a group intervention. We were absolutely ready to roll with that. And to do a full-scale rollout across Scotland, which was fantastic. It's a group intervention, and of course at that time suddenly in the UK services just stopped, so we couldn't reach the people that we needed to reach. So we had to rethink it, and the only way that we could continue to do that work was through using Zoom and using kind of home technologies, Zoom, Skype, kind of other very, very simple digital technologies as a way of helping people with dementia to connect with the therapist, but also to connect with the other people living with dementia. So that intervention really places people with dementia at the centre of the intervention as the expert. But of course, it's such a big leap to go from not really using the technology to using the technology. And so the way that we developed that is that we created a hybrid we created, we built a really lovely website called Connecting People, Connecting Support, where we took the research that we were using and we embedded it within that. And then we connected each of those facets of that research, of those topics, to a set of really beautiful postal packs that had part of the content of the weekly session contained within that. And they were posted out to people in a really non-stigmatizing way. And as you can see, we'd learned a lot from the project about the way that we designed for people with dementia. You know, these were not medicalized pieces. These are really, really beautiful, high quality things that people wanted to have and wanted to have at home. And immediately we discovered that, number one, people with dementia could brilliantly connect with the technology, and actually the therapists found it incredibly helpful. And actually it was, in many ways, because so many parts of Scotland are so remote, it was better. You know, COVID aside, it meant that people could continue to have those interactions that they needed, that they craved, and that were absolutely integral to what they were doing. And straight away, people described about how the very simple technology communicated value. They found that that it became a place where families could connect, as well as connecting with people in the community. And the quality of the physical was as important as the connection with the technology. So there was something about a kind of a hybrid space that was being created. The other thing that the therapists took away from that was the fact that it offered people time, and the fact that rather than people just jumping straight into something, people were really prepared for that. And so through that, there was a really wonderful service development that has occurred through something that was kind of quite disastrous and difficult, into something that has actually made a kind of a positive moving forward. And actually, as I said, because of the way that Scotland sits and it's framed, it's meant that, you know, people who would normally be in very remote places can now connect back with the technology. So, you know, there's a lot there. And certainly, you know, the 100-year life, the way that we might think about, you know, how we interact and continue to engage with that, absolutely, you know, that's a massive important finding for us. And again, the feedback and the findings for that work are fantastic. Again, you can ask me about that. The other example is a future care home, and this was more of a methodological approach, and I have talked about this in other places, but if you've not heard this before, you know, straight away we weren't allowed to go into any care homes in the United Kingdom. All of our work in Lab for Living is engaging with the community to design with people. How are we going to do that? So we were very pragmatic, and rather than when we realised that we couldn't continue to design with people, the very simple solution that we followed was that many care staff, because of the number of residents who were actually dying in care homes in the United Kingdom, they were furloughed, so they were laid off work. So what we did is that we used the engagement and the engagement methodologies that we had with people already, and we actually employed care staff as researchers, and we trained them as researchers. And actually we discovered that through that process, and through using really simple technologies like the Zoom and like Microsoft Teams, we could actually continue to work really closely in places that were inaccessible to everybody else. And, you know, and again, engaging in this really interesting process of remote co-design, where staff on the ground who knew most about the residents that were living there could create and design things that were just gifts for people, that enabled us to really understand the true context of what was happening, but also enabled us to respond really, really quickly, and to find ways of really reaching and working alongside those individuals, and to create at a time where, you know, in the United Kingdom, things were so much in crisis and the care homes were so hit, that we could actually do something that really did address quality of life. And, you know, this is just one of the examples of things that came from that. You know, we discovered that the biggest challenge that many care homes had is that around technologies is that they simply didn't have access to the internet. So we made these really bespoke pieces that didn't require the internet, but that had very simple RFID readers within them, and that we could create really personal playlists that even went beyond that, where families could record important messages to people that they couldn't go and see, people who were dying. And actually, you know, at a time when people were separated, that we could use the technology to bring people back together. So it's been a really, really interesting journey. It's been a really, really interesting journey. You know, we started off with like this amazing vision of what the 100-year life was. We started off with this kind of, wow, you know, we're all going to live to be 100. COVID hit and the 100 years became more of a metaphor for what that might be. But I think from all of that, we've also kind of taken things that we've learned, and, you know, they might not be the most kind of groundbreaking, sparkling, incredible things, but what we learned about was pausing and trusting in our methodology and the way that we might want to truly work with people, but truly rethink about maybe what technology means for us now, for us in our 100-year life, but also for the people that we're serving and we're working alongside. And there are so many, you know, I feel really privileged and I feel really humbled. You know, sometimes we can think about technology as this really hard thing, and that's very difficult and very clunky and digital technology. But I think there's just something that is so, in those connections that we've seen this make, there is something that is really quite profound and quite extraordinary. And I think it's the simplicity of the things that I've seen that I really want to just end with today, to say thank you. But please, jump in, ask. Sorry, it's been such a whirl everywhere, but there's a lot I wanted to say. And yeah, anyway, I will end it there. Hopefully we've got enough time to talk.
Thank you so much, Claire. That was such an uplifting, beautiful presentation. And the way that your group is supporting this positive life journey, you know, positive aging, positive living, it's tremendous thoughtfulness and generosity behind all that work. You know, it's a privilege for us to hear about the work. Yes, we would love to open this up now to questions. And my understanding is you'd also maybe love to hear about other people's research.
I'd love to hear about what you're doing. Absolutely, it's lovely. It's just this is another great ways to connect, isn't it? You know, we're at the other side of the world in completely different time zones, but I suspect that we're all as passionate about the people that we work alongside, and it's great to share things. So brilliant. Over to you.
Yeah, so Kathleen, would you like to say something about work? You have a message in there, and I'll look out for other raised hands as well.
Hi, just to say thanks, and I just put in the chat plug for our postgraduate subject that connects really well, and I believe some of our students are actually listening to Claire's talk. But
brilliant.
Yeah, the idea, the ageism in the tech development space, in consumer tech and in biomedical tech, really needs to be overcome. And I'm really behind the work that you're doing, Claire.
Brilliant. Honestly, I'd love to have loads of conversations with you about that, because it's so important. It's just so vital. It's so vital. And, you know, if we have to challenge it, we do absolutely have to challenge it. Yeah. Thank you.
And just, I mean, to add, I think it's quite unimaginative too. Some of the tech development, it's very limited in its conceptualization of what older adults can do, want to do, should be empowered to do in society. Completely, absolutely, yeah, definitely.
Thanks, Kathleen. I'll move over to Zarina. Zarina, hi.
Thank you, and hi, Claire.
Hi.
Just a beautiful talk in so many ways. My interest is in people who have chronic conditions across the lifespan. And
Yeah.
I was really intrigued by your ability to recruit people in very remote areas. And I was wondering, how did you go about engaging with people in remote areas, and how did you account for issues such as digital connectivity and digital literacy?
Yeah, it's honestly, and again, it's really, really interesting. So we were able to tap into incredible grants that are there for people, but nobody knows about them, number one. So that's really important. The second thing that we did is that we found, it's really interesting, it's about how you work with communities. We've already got people who are really active, who are older people, volunteers who are already active and working in that way, who know other older people who aren't as active, and how we marry those two groups up together. And it's that reciprocity. And it's taken us a long time to do, and we don't always get it right. But a lot of it has been for us kind of tapping into what I almost call community activists, who are just these amazing folk who are often go under the radar, but who know more about their communities than we would ever know about communities. And then literally, so it's almost like the reversal of what research is in a kind of crazy way. Often loads of times I feel like I'm their research assistant, basically, which is amazing, Serena. So, so then I'll start something, and then it's like, no, I'm almost then serving them. And I'm like, oh yeah, you're on tap, Claire, by the way, what about doing this and what about doing that? But then I've got there's this amazing in. And then often what happens is they come back to me later and say, well, we've got this now. Will you come and help us to do that? The biggest challenge we had to overcome with that, though, was the belief of the therapists and of staff working with people living with the kind of chronic condition, particularly people living with dementia, and that notion that, oh no, people just won't be able to do that. Actually, people were more proficient than the therapists were at using the technology, and that wasn't everybody, I've got to say, but the majority of people. And I think it was that again, it's that really strange attitude, oh, people won't be able to use it, and then actually it was the lack of confidence of the staff rather than of people, because the people that we're working with had to be incredibly resilient for so long that they'd developed their own coping strategies and mechanisms, and sometimes technology was part of that. But I do think that there were, there are still those groups of people that we need to reach now, and we need to be reaching people in their 30s, 40s, 50s. We need to be reaching them now, because I think, yeah, it's really important. But yeah, is that helpful?
Thanks, Serena. Mark, I think you're next.
Yeah, hi, Claire. Look, thank you very much for obviously the great energy you bring to this prospect, as well as your ability to attract funding, which I applaud. I guess
at
I'm
midnight.
always, yes, especially at midnight, talking about it. But I guess what I'm most interested in is also the bridge to commercial and bureaucratic realities as well. That, obviously what you do in a living lab research environment, which obviously is linked quite specifically to commercial realities as well. What have you found the major challenges in that pipeline relationship between either that or the bureaucratic regulatory sort of propositions that we all face as we try to translate things into practice?
Yeah, so we really look at, so I think I'd say on lots of levels, so every project's slightly different, first of all, to say, Mark, depending on what the project is. Obviously, we're lucky where we are in Lab for Living, because there is a kind of commercial part of the university that was founded about 20 years ago, where Sheffield went through a really big economic dip, and the government invested money in this group, but they're purely kind of commercial, they're purely consultancy, but they're not research, whereas we're research. But through those links, what we do is we work in partnership with them. So often, because they've got such fantastic connections and networks, they're really helpful at saying to us, look, that's the partner you need to involve. And wherever we can, we involve those commercial partners from the beginning. The challenge with commercial partners is that they just want the result. And what we've seen over the last 14 years, because we work closely with Design Futures and with, so that they have people coming in for consultancy, but not research. We have the research, but we want to get it out there. And somehow what we've seen over that time is that the people who are coming in who just want consultancy can see the benefits of seeing when something is research based. And you know, and there is that shift and that build up. You know, I mean, I think often in consultancy and commercialization, there's a real fear of the time it takes, and particularly in medical research, which can take 14 years to get out into the real world. So some things we've got are really quick gains. Some things are much longer but are more relationship building, but everyone is slightly different. But we've got probably over 150 products out into the real world, and sometimes those products have stimulated industry. So like, for example, one of the things that I shared with you that actually went out to a fantastic, a very small SME, sorry, it was an SME that then boosted it, and then it's grown, and you know, and it's fantastic. So what we're seeing now is this economic benefit to society as well. The biggest challenge we have as well is, you know, the regulatory and what counts as a medical device and when's a medical device not a medical device, and then the Europe, like all the guidelines, you know, people just get swamped in that. But for the majority, we've been pretty good. But it's never dull. But we always get the partners on right from the very beginning. And I think because you're just so old now, just like they know us pretty well. So, but it makes a really, really big difference. But it's still a bit of a battle. But yeah. So
to take Kathleen's point, if we design for the old, we'll design for the young as well, instead of the other way around. And we need to turn that Titanic of design around. So
we really
designing
do.
For the aged and disabled and others, and it will always be accessible, therefore, for the younger who are manipulative.
And if we design it, yeah, absolutely. If we design it well, then it works, doesn't it? And actually, you know, I always say, if you design well for somebody living with dementia, it'll be great for everybody because it'll be there. And I think, you know, for me, you know, part of, I think one strand of the work, obviously I couldn't talk about, is now how we change the way that designers think about aging. And I think that's really important, you know, our 18, 19-year-olds and how we shift that. And I think that's massive. Absolutely. Yeah.
Well,
I wish I could be there. We'd have some great conversation.
Yeah. Thanks very much, Mark. Wendy. You're on mute, Wendy.
Thanks for such an excellent talk. I wanted to bring up some things that we're doing that are similar and get your thoughts about and advice about it. So I loved the Lou Lab, and we're building a simulation lab that will have a digital ecosystem. And in the digital ecosystem, so I have a physical space and a digital ecosystem. And the digital part will have simulated electronic medical records, devices for patients, so that you've got the data flow going. And then once you have that sandbox, you can start to really ask a lot of questions like, what are the best, you know, user interfaces for older adults? But you have ways of testing the data flowing across and building different interfaces. And then that physical space, you know, looking at workflows. But what I want to do and don't quite know how to do is how to bring in the public, like you did. Once we have this space, how do we bring people to it and leverage their thoughts?
Yeah, I mean, so much of that. I mean, the Glue Lab was great, and you know, I mean, we had like a bog blog, and where people sat on a simulated toilet and spoke into a video. I mean, it was really performative. And for England, Wendy, it was really funny because the big challenge that we had was people didn't want to tell us what they did in their bathroom. So they were like, oh, we're British, we don't talk about things like that. And we were like, no, we need you to. So that's why we made it into quite a kind of a really kind of performative space almost. You know, we advertised it. We had like this element of fun. You know, we had people, it was like the maze was a bit like lab rats, and people, we dressed up, and then we got people in and we did it in really public places. And it was that kind of normalization of that bit, and people were really intrigued. And, you know, it was like that. And it was that kind of, it was really interesting because we obviously, you kind of collected a lot from kind of people who were good at that. But then later on, as people became intrigued and interested, that's when we started getting the really interesting stuff. So the initial flurry of, oh yeah, this is fun, to then really starting to drill further and further down. And we've done quite a lot of that. When we did the engaging aging, we use exhibition as a method of, you know, we use gallery space, we use exhibition space as a kind of method of data collection. And, you know, when we did the project in Taipei, I think we had a footfall of 50,000 people a day, because we ran that on where the underground was, and bringing people in to have a conversation. It's finding those really sweet spots of, in the community, in spaces, in a way that engages. The other things that we've done is we've had done exhibitions, small exhibitions, and changed something every week where people add to it. And you know, they're just we just probably have a bit too much fun, to be honest, Wendy. I don't know, but but I think there's so many. I think for us that notion of exhibition as a space where people come and talk and engage, and because really, and that kind of came back for us. You know, it's like a theatre for conversation. It's how do we create theatres for conversation? So you know, but that bring people into the space, and for us, universities can be such inaccessible spaces. Nobody wants to go into a university because it just feels so alien, doesn't it? You know, oh my word. So we take the stuff to people in whatever way we can, really. There's colleagues in Lancaster, they're doing some really interesting research around bathrooms, and they've adapted a caravan that they take around, a mobile home, and that's their research lab that they're using. So, you know, I think there's some great stuff. Yeah, but yeah, I'd love to hear more about it, definitely. I can see Sonia Padell.
Yeah, Sonia.
Hello, Claire. Thanks a lot for another very inspiring talk. And I love how you're focusing really on the lifespan. And I'm wondering if that is also something that we might have lost a little bit, that whole notion of a life journey. And we have in Germany these candles. You get it for your birth with little pictures, you know, the baby, and then it's religious holidays, and then the confirmation and the marriage and the children. It ends up with your funeral. So you have a life candle that you burn through your life, that very physical manifestation of your life. And I love what happens in design is we are designing in the here and now, and we try to shift it into the future and envision the future. But I think what we really need to do is having the trust. And you're asking, what if you lived for 100 years? We should all assume we are living for 100 years. I mean, we can all be run over by a bus tomorrow. But I think that how can we shift that positive thinking into design and really plan and design for that journey? That's really something I'm wondering about, because I think it has to do with agency. People are hit by a life situation, then they start thinking, what do I need now? What decision do I have to make? How can we do that designing and decision making kind of more as planning ahead towards the different stages?
Completely. And that's why I think why we like that multi-stage life, Sonia, as well, because it moves away from the idea about how we stuck in our head about thinking about what age is. But I love the candle, and I think we should definitely do that. That would be such a great thing to have. But I love that idea, and I think, yeah, absolutely. And I think it's really interesting as a research group. We've thought loads about ourselves. You know, it makes you think about you, and I think there's something that's really fantastic about that, because it makes you also think about finance and technology and finance and how you're going to do this and this, and it's every facet of your life, not just this kind of, it's about health and it's about this and it's about deficiency or not achieving something. It's about the whole gamut. And I think what we've seen in COVID is it asks us big questions about our future home as well, and how we think about that through the lifespan. So yeah, there's so much to be thinking about there. So
thanks for the question, Sonia. I really love the idea of a candle as well. And Claire, you've really provided us with so many thought-provoking ideas and beautiful things to take away. And again, you know, we can't thank you enough for the privilege and honor to have you with us, and considering also the time difference. So hopefully our next conversation,
I promise
we hope we will
coherent.
have
Sorry
many of you.
about that.
No, we're sorry that we will have it in a better time for you, but you've been so energetic and wonderful. And I'd like to conclude this to thank everyone also who attended and for your questions and very positive responses to this seminar. Our next seminar will be with Professor Peter Haug, Director of Warner Center for Informatics Research at Intermountain Healthcare from the University of Utah. Thank you very much, everyone.
Brilliant.
Take care. Have a good day. Thanks again,
Lovely.
Claire.
Thank you. If people do want to get in touch, please do. And certainly around oncology, I can see a comment there. So please do, definitely. Take care, everybody. Have a good day.
Yeah, have a good night. Take care.
Take care. Bye.
Well.
Bye, everyone. Bye. Thank you.